So I'll be doing this seesaw on rheumatoid arthritis, which is an autoimmune disorder that affects multiple joints throughout the body, and it affects women more than men, and is actually present in a large amount of people. And one of its primary conditions is that it has flare-ups and remissions of deep pain and inflammation of the joints there. And it can be mild or it can be unremitting and progressive. The general intake questions that you'd be asking of this person is what their general health is, how long they've had the condition, is it progressing, is it getting worse, has it been affecting any other organs or systems, what is the diagnosis from their doctor, and maybe get them to try and keep a journal of all the different frequencies and timings of the different flare-ups that they're having, and that way you can get a bit of a sense of the pattern that the disease seems to be taking in this person. Also, you can check out which are the affected joints, the current signs and symptoms, also maybe some signs and symptoms they've previously had and have disappeared. And how is it affecting their activities of daily living and functional abilities? Especially with rheumatoid arthritis, there's a lot of problems in doing activities of daily living, such as brushing teeth, combing hair, because the primary focus is going to be in the hands of a person. So you definitely want to get a good idea of what their abilities are at home. And also, they're going to be on a bunch of, possibly beyond some medications, particularly anti-inflammatories such as NSAIDs, or possibly some other medications there, such as prednisone or other things to kind of help with the inflammation there. You want to see if they maybe be on the path to surgery or have previously had surgery. And also see who's all in their healthcare team as well. See if they have a physio, see if they have a naturopath, exercise specialist. And also at the final bit, just kind of keep in touch with their physician. See if you were recommended to have massage therapy with their physician. But also let them know there that you're seeking some treatment with yourself as well too. Some notable assessment findings you may be finding is that there's going to be multiple joints with pain and large amounts of swelling. Often they stay in the hand but can progress all throughout the body and may not be systemic, so it could just in a line. So it could be hand, knee, but not anywhere between. And also the skin may be quite shiny because of the increased inflammation there. All that will lead to limited active range of motion and passive range of motion due to pain, and also the tissue stretch is just not going to be there because of the size of inflammation depending on the progression of the disease for this patient. You're going to have some generalized aching, sluggishness, fatigue, possibly some weight loss can occur as well too. So you want to be checking that in their health history and making sure that those aren't cropping up. Also they may have some incidents of genu valgus, so that's definitely going to be one of the things that as a massage therapist we can actually work on and try and help those muscles that may be limited or weak because of the weakness to the joints. That brings us to some of the treatment and technique modifications. First, you want to be checking in a lot with the pain scale because it is such a painful condition, so developing that good communication, always working with their pain scale is going to be one of the primary focuses. Range of motion, passive range of motion helps decrease pain and stiffness, and manual lymph drainage may help move some of that edema and possibly some of that extra fluid out of those swelling of those areas. General Swedish techniques, when done gentle, can help resolve some of the poor alignment from the muscles and the weak joints. And hydrotherapy can help relieve some of the pain and in that tendonitis area in the affected joints. Paraffin wax is also very effective in some of the affected joints there. And you can also use a shunt to help move fluid away from those very swollen joints. One of the important parts for the treatment plan are going to be the remedial exercise. Swimming in a pool is shown to be very effective. Try and do that 2 times a week because there's a study that was just recently shown that shows that that is quite effective in reducing the pain. Also, try and increase your walking there. And our goals are going to be to reduce inflammation, which is the primary focus of the pathological parts of the disease, or the damaging parts of the disease, reduce pain, and maintain range of motion in the affected joints there. And finally, you can also use an ice pack to relieve some of that pain. I'd say try and do that in the afternoon or evening, but use a warm pack or a warm shower in the morning to help ease that stiffness. Also, I would like to see that patient for 1 time a week for 8 weeks, 30 minutes duration, and I'll reassess in 4 weeks.